did you know that your diet has a major impact on your ability to have children, as do exercise and acupuncture?
So if you're trying for kids or hope to have children in the future, then we've got some pretty important advice for you this morning. Martine Millett-Johnson from the Kilkenny Clinic and acupuncturist Mary Hayden join us now to discuss it. A very good morning to you both.
Good morning.
Good to have you both here. Mary's making her morning show, David.
Oh, don't be nervous.
My television, David.
Anyway, Martine, body weight, it can affect ovulation. How?
Well, I suppose the main condition that everyone will think of, because we've mentioned it on the show before, is the polycystic ovary, because not all people with polycystic ovary are overweight, but for those that are, it greatly affects how they ovulate, and it's
Now, did you know that your diet has a major impact on your ability to have children, as do exercise and acupuncture?
So if you're trying for kids or hope to have children in the future, then we've got some pretty important advice for you this morning. Martine Millett-Johnson from the Kilkenny Clinic and acupuncturist Mary Hayden join us now to discuss it. A very good morning to you both.
Good morning.
Good to have you both here. Mary's making her morning show, David.
Oh, don't be nervous.
My television, David.
Anyway, Martine, body weight, it can affect ovulation. How?
well, I suppose the main condition that everyone will think of, because we've mentioned it on the show before, is the polycystic ovary, because not all people with polycystic ovary are overweight, but for those that are, it greatly affects how they ovulate, and it's related really centrally to an increase in insulin resistance. So the diet that, that's in the news and has been now for some time is the low GI diet. It's like the diet for diabetics. That's low in fat and sugar, obviously, high in fibre, not a lot of red meat, low in wheat, and I suppose full-fat dairy, and that diet is hugely important for people with a polycystic ovary, because even a percentage drop in weight will encourage ovulation. So it's not just lowering your diet through taking things that are low in sugar and fat, but it's just anything like exercise, regular exercise, particularly weight-bearing exercise, so that you get that percentage drop in weight. And the same low GI diet is of use to people with endometriosis, another condition that affects fertility. And very recently we mentioned on the programme how a low GI diet can benefit males who have infertility. We mentioned that normal sperm may not be that normal. In fact, the DNA makeup in the sperm, how the DNA, the genetic material is packaged in the sperm, may actually be fragmented. And when it's significantly fragmented, it can impact on fertility hugely. And a low GI diet is being heralded as the way to reduce this fragmentation. I mean, obviously you'd have to keep your weight down as well for the men, exercise regularly, cigarette smoking huge, alcohol consumption, diets that are high in magnesium, zinc, chromium, selenium, all these antioxidants, the omega-3, 6 and 9 supplements, these are all very important for both male and females.
So what food, if anyone out there is trying or thinking about having kids in the future, what should they be including in their diet now? Like nuts and cereal and things?
It'll be whole grains, beans, leafy green vegetables, oily fish, so tuna, salmon, herring, that kind of diet, keeping red meat to an absolute minimum, if not taking it out, full-fat dairy to take that out, and use all low-fat dairy produce, and wheat, reducing the wheat content. And as a nation, we eat an awful lot of wheat and we eat an awful lot of bread. We'd be second only to the UK in our consumption of wheat.
Wow.
But we also have to watch, especially guys,
Yes.
alcohol.
Yes, alcohol, and we should couple smoking with that, hugely affects fertility in males and females, but particularly with regard to this DNA fragmentation that I've mentioned in males. So if men out there are listening and they're consuming more than 21 units of alcohol a week, and for women more than 14 units of alcohol a week, this will impact greatly on your fertility. And a unit would be consistent with a small glass of wine, half a glass of beer, or a unit of spirits.
Because it reduces zinc levels, isn't that right?
That's right, and also our ability to absorb the B vitamins, iron affects our calcium intake. So B12 in particularly would be one that would be affected.
Could you not then just supplement that by eating foods high in zinc? Like Brazil nuts and...
Not really. I mean, the supplements are wonderful, but I mean, again, we go back to balance. I mean, if there's an overindulgence in a particular item in the diet, so alcohol or fats, particularly the saturated fats, we've got to look at the unsaturated fats, well then that's going to hugely impact on how we absorb all the minerals and trace elements and vitamins.
Before we move on to acupuncture and how that can help with fertility, we're a nation of tea drinkers.
Yes.
Caffeine, what about that?
Well, caffeine has been implicated in a huge number of studies with regard to diseases, various diseases. But the reality is it isn't great to overindulge in caffeine. But at the same time, it hasn't been shown in all the large trials to be the sole thing that can impact on fertility. So we'd have to say that coffee drinkers out there, it's okay to drink coffee, perhaps to drink the freshly brewed stuff, but not in huge amounts. You're talking not more than 6 cups a day.
Okay, Mary, acupuncture, you were telling me earlier that it can help boost men's creation of sperm.
Sperm, yeah. So acupuncture, along with diet and exercise, obviously plays a key role. Like if for poor sperm quality, for DNA fragmentation, high DNA fragmentation, as Martine has spoke about before, for morphology, the shape, acupuncture, the research is there to show that it plays a vital role. It takes 3 months to make sperm, so...
Yeah, 3 months to make sperm, did you know that?
Oh, I wasn't aware of that, no.
So the advice would be to,
go 3 months before you were trying for it.
Yeah.
Wow.
So if you're just contemplating having a baby, you really need to be doing this in 12 weeks.
12 weeks
before.
prior to
yeah.
Okay, does it work hand in hand with fertility treatments?
Yeah, like acupuncture can be used for natural conception, can boost natural conception, or for people that have underlying condition and are going down the IVF route. Like this Paula study is out there to show that, you know, acupuncture alongside IVF increases the rate from about 30 to 50%, you know, the conception rate.
And are you talking about for women or for men, or are you seeing both men and women coming for it?
That's for women. We would see a lot of women come. It's become very popular, you know, there's a lot of research and there's a lot of findings out there that encourage women to come along. We would like to see more men coming along.
Well, if they knew it takes 3 months to make sperm, they probably, there might be a few more coming.
Like stress plays a huge factor, obviously, you know, so acupuncture is very good for relieving stress, you know, and trying for a baby is probably a very stressful time.
I actually don't know anyone who's been for acupuncture. Maybe you do you?
No.
No, I don't know. The misconception is that there are large needles, but they're not. They're tiny little things.
They're not at all like injection needles. Like, they're very fine, and they're obviously sterile and single-use, disposable. Some people do feel a little pinch when the needles are being inserted, but most people actually fall asleep during the treatment, so...
It's very relaxing.
It's very relaxing.
And how does it work? Like, how does it help?
So, the Chinese, in traditional Chinese medicine, we say that the body is made up of qi, which is the vital energy, and when qi is circulating, qi circulates around the body in what we call acupuncture channels, they're also known as meridians. When qi is flowing freely, like there's proper balance, but when a blockage occurs or when there's like qi is flowing the wrong way, that's when illnesses start. And obviously, you know, when a problem starts, the sooner you get it rectified, the better. It's very good, like, for regulating periods and for regulating, you know, helps ovulations. It balances the hormones, very good for painful periods and all that. So not necessarily, even if women aren't trying to get pregnant, a lot of people suffer with painful periods, so
Okay. Exercise goes hand in hand with acupuncture. Mary said at the start it works, exercise, diet, acupuncture. What exercise should we be doing?
I think the simplest thing, walking, because it's weight-bearing exercise. So, for example, with somebody who's overweight, you're going to increase your burn-up, while at the same time you're doing a lot to increase blood flow to some of the vital organs. It's also a very good aerobic exercise for heart and lungs, and it's simple. It doesn't cost you anything to get a good 4-mile walk in. you know, at least 3 times a week. And then you can do simple exercises like the yoga exercises, just sitting at home, you know, the simple stretches. It doesn't involve too much effort, and that's also a very good aerobic one. And I suppose that the best one of all, because you can't injure yourself, is swimming. The one drawback there is it's not weight bearing, and for somebody who is very overweight, so we go back again to the polycystic patient, but I stress not all polycystic patients are obese. They probably won't burn off as much energy, they won't increase their burn up by swimming lengths of the pool, whereas walking around the block, they will.
Do you have to be careful not to over-exercise?
Yes. Absolutely. I mean, again, we go back to this balance.
Yeah.
I mean, ideally, if you have a BMI, so a body mass index, under 30. But I mean, if you drop that significantly, so that you're now underweight, you've got another set of problems. You know, you're back again in the infertility area. So people who over-exercise, over-diet, and they become too thin. Well, we're also facing problems there. So it's about balance again, and striking the right balance.
And leading a healthy lifestyle while you're...
Yeah, and starting young. You see, this is the thing. If you look at all the teenagers and all our you know, the young people coming up, I mean, to start then with a healthy diet and exercise, not all our snack foods, you know, to learn to graze, as the Americans say, not to gorge, and to avoid all the snack foods, you know, the pizzas, the chips, the crisps, the sugary drinks, to eat at least 5 to 9 portions of fruit and veg a day, because men are very bad about eating fruit and veg. So they say that they should eat 9 portions of that a day compared to the women, who should have about 5. But they're encouraging, if you put something in your children's lunchbox now, you know, that's chocolatey, or more of a snack, or too much bread, it'll be sent back home again. So the schools are really working hard to get the fruit and veg in there, and the carrots, and you can see the ads on television are encouraging that as well. Start small.
Well, for now, Martine and Mary, thank you very much.
Thanks for coming.
In August last year, a lovely couple introduced to us actually by
Martine,
by Martine, Charmaine and Sergio. They come on the show with Martine to tell us about trying to conceive, and we were discussing polycystic ovary syndrome at that time. If you don't remember them, here's a little reminder about their story.